Thank you. And the issues for me is, do I give a great speech, a long speech, or do I make it short and get your love and affection for doing it? And I think I'm going to do that. First of all, I have to say that I'm incredibly honored that you have asked me to be with you tonight. And I want to say that one of the things that makes this evening memorable is that you are recognizing a dear, good friend of mine and a friend of all our communities, and that is Ken Rasky. I have worked with Ken for so many years. And the story to be told is that, if we talked about programs for Latinos, or it is basically, and now we're talking at La Familia, is basically a great number of our community is basically Medicaid. And the fights that we had throughout the years have been to make sure that we have as much resources to take care of the poorest people in our society. And in that sense, by honoring Ken Rasky, you're honoring the sense that society should take care of those who cannot take care of themselves. So I am very proud of the honoree that you have here tonight, and thank you for doing that. What message can I deliver to you tonight? First of all, you know the statistics. The statistics are basically that we lack in insurance, we lack in healthcare coverage. We are, in terms of our life expectancy, in terms of diabetes, you know the statistics. We don't have to preach that. The question is what we're going to do about it. We just had enacted healthcare reform, in which one of every 3 Latinos in the United States do not have healthcare coverage, and now we have the opportunity for them to have it. Let me do a segue here. There's about 8 to 9 million Latinos who are living in this country but are not American citizens, who are quote-unquote undocumented, who would not have a right to participate in any of the benefits of this. So, in that sense, you here, the Hispanic executives in healthcare, have a lot to do. And one of the things that I learned in my journey, it is that leadership matters. Leadership matters. And in that sense, you are the leaders of this community. You are the Latino leaders in healthcare. And in that sense, you have an immense sense of responsibility. And I have to tell you, and I gotta be very honest with you, I want to level with you, I feel I have the moral authority to tell you that. And because I worked incredibly hard to get past this legislation, basically when we demanded those who were candidates for president of the United States, that in order for us to support them, they had to have a health care plan. And if they did not have a health care plan, we would not support them. So, and as a result, all of the Democratic Party candidates had a health care plan. I feel kind of the moral authority to tell you that. I feel I have kind of the moral authority to tell you that when we put together the coalitions with the employers like Walmart, AT&T, and other companies to say, why don't we all come together and try to solve a problem that in this country we have not solved for 100 years? The issue that we could have healthcare access to everybody in the United States. I feel the moral authority when I say that we went, and I had a conversation, and Ken is witness to that, with the American Hospital Association, American Medical Association, the American Pharmaceutical Association, American Devices Association, American Insurance Association. Every single group who had literally, at some point in their existence for 100 years, stopped healthcare reform, and we brought them to the table. And we then make healthcare reform happen. And by the way, this is like the is that the old man in the sea. We started with a big fish, and at the end of the day, when we got there, we lost a big share of what we thought what we wanted in healthcare reform. It was a big compromise. But now the question that is being asked is the glass half full or half empty? I would say that the glass is half full. No, every country is struggling with the challenge that we have. Healthcare costs, what are the outcomes that we have? How do we give the best kind of care? How do we deal with the incredible issues of having a population that is living longer, and we want to control those costs. So, in that context, you have an amazing opportunity to, and particularly the theme of your dinner tonight is mentoring and leading people in the healthcare field. I have to tell you, when I went in this journey on the healthcare reform stuff, I was feeling my way into it. And at the end of the day, I was so surprised how far I got, me individually and collectively, in the sense that it just took the desire to make it happen. The point that I'm trying to make to you, and I hope that I can make it, it is that you can make an amazing contribution to our society, particularly in a community where it's so lacking. I was member of the Robert Wood Johnson Foundation Commission to study planning for a better healthcare in America. And when I found out that in the Mexican American community, 50% of the children who were born after the year 2000, they are predicted to have diabetes because of the eating habits and their lifestyle. Something that we know at this moment that is completely preventable if we reorganize our behavior. What's my point? My point is that you are the leaders of the Latino community. You are the leaders in an area that you can have an immense impact, and the question is, are we prepared to lead? And I'm challenging you today to make that happen. I think that we have an enormous opportunity right now. I think that I will invite you to think that whatever limitations you think that exists out there, and I really believe it, because those are the ones that I confronted. I'm sharing personal experiences. It is not what you perceive that to be the problems, but what you perceive to be the solution. Chase them. Go for them. I believe that we can make them happen. And I believe that our community needs that leadership. And you know that? You chose to be the leaders, the executive leaders, the Latino leaders in the healthcare community. You got to lead. Go for it. Thank you.